Welcome and thanks very much for joining me. My name's Nichole Hamilton. I'm a physiotherapist with Physio on the Sunshine Coast of Queensland, Australia. And what I'd like to do today is share some tips and ideas on how to manage pain on the outside of your hip and how to adjust your yoga posture to minimise pain in this area. So there can be many reasons for pain on the outside of the hip, which is why it's always advisable to get an accurate diagnosis from your health practitioner. But what we'll be focusing on today is pain originating from the gluteal tendons and where they attach onto the outside of the hip. Pain from gluteal tendons is often aggravated by lying on that side, walking up hills, and certain yoga postures. So let's start by having a look at our anatomy. So we can see on the pelvis here that the hip socket actually lies deep within the pelvis. So the ball and socket joint of the hip is actually in the groin. So if you have any problems with the hip joint itself, such as osteoarthritis, you'll tend to feel it in your groin and sometimes radiating down the front of your thigh. The ball part of the femur angles out to the side and forms a bony prominence before turning down to form your femur or thigh bone. That bony prominence is called your Greta trochanter, and you can find this on yourself as the widest part of your hips on both sides. And it's here where your gluteal tendons attach. So your gluteal muscles start at the back of the pelvis. The muscular part turns into a tendon, which is a bit like a rope, before attaching onto the outside bone. So it's a muscle, which is a bit like a spring, then a small rope like tendon, and then bone. Also lying over this outside bony hip prominence is a small sac of fluid called a bursa. Now you have bursas all over your body and they act like cushions just to protect bony prominences. So you've got them on your elbows, your knees, your shoulders, and the bursa on the outside of your hip is called your trochanteric bursa. So what happens with tendon-related pain? As we know from our anatomy, tendons are designed to be thick, firm places of attachment for our muscle onto our bone. So if you can imagine your tendon a little bit like a thick rope, what researchers have found is that when people have tendon-related pain, it's almost like the rope has started to fray a little bit. So if you can imagine a frayed rope, you certainly don't want to stretch a frayed rope, you don't want to overload a frayed rope. What you really want to do is to take the pressure off and to stitch some new fibres in that rope so it's ready to go again. Our tendons are a little bit the same, so if we have signs of tendon wear, which we call tendinopathy, what we really need to do is to take the pressure off, avoid stretching it, avoid overloading it, and then start a series of exercises in order to strengthen and repair that tendon so we can use our own healing processes in order to restitch some new fibres in. So how do we modify our yoga practice to avoid irritating this gluteal tendon further? Well, the most important thing is to try and avoid deep buttock stretches, which is essentially any posture where you might be taking your knee or your ankle toward your opposite shoulder. So let's have a look at a few yoga postures and how you might modify that. So to protect the gluteal tendon, the main postures that I would modify or avoid in standing would be revolved trikonasana. So you can see that in this position, she's taking her shoulder toward her opposite knee or opposite ankle, which can place a big stretch on that outside tendon, which if it's a little bit frayed is not going to be happy with. So to modify this, I would actually take out the twist and just come into a straight pyramid pose, which removes part of the stretch on that outside tendon. So the next standing posture that I would look at modifying or avoiding for this gluteal tendon would be revolved Parsvakonasana. So you can see again in this position that cat's shoulder is going toward her opposite knee, which again places a big stretch onto that outside gluteal tendon. To modify this, I would just stick with a straight Parsvakonasana, which removes part of the twist and takes a bit of the pressure off that gluteal tendon. So I found on that gluteal tendon that sometimes even sitting cross-legged can be too much if it's particularly irritable. One way of managing this is to actually sit up on a bolster so your hips are a little bit higher, or for longer postures such as for meditation, you can try a Vajrasana position or a kneeling position, which just takes some of the stretch out of that outside tendon. So seated forward folds like this, again, are probably best avoided in the short term because they do take the ankle toward the opposite shoulder and place a lot of excessive stretch on that gluteal tendon. So Ardha Matsyendrasana is another position or posture that I would avoid, again because it takes the shoulder toward the opposite knee, which does place a lot of stretching load onto the outside gluteal tendon. The way to modify this would actually be just to twist in the opposite direction until your tendon has recovered. That way you can still get something out of the posture without overloading the tendon. And the same idea can actually be applied to any of the other buttock stretches in this position. So again, taking the shoulder toward the opposite knee is not ideal, and twisting in the opposite direction is a nice way of modifying these postures so you don't actually place excessive load on the gluteal tendon. So pigeon pose, we all love pigeon pose, but it's a really huge stretch on the gluteal tendon, and again, it's probably a posture that I would actually just avoid in the short term until your tendon recovers. Supine spinal twists are usually okay on the gluteal tendon, provided you keep your knees and your ankles fairly low. If you take your knees or your ankles higher, again, that can place excessive stretch onto that tendon. So I'd probably just keep it low for those postures. So if you'd like to know more about the management of gluteal tendinopathy, please see the education page of my website, which is synergyphysio.com.au. Tendon recovery can be typically slow due to the limited blood supply in all tendons. So my advice would be to have some patience in your recovery and also to seek the advice of a physiotherapist who might be able to provide you with a very specific strengthening exercise program for your tendon in order to aid its healing and recovery process. Thanks very much for joining me, and I hope the information that I've provided has helped you find ways of modifying your yoga practice to help you with your recovery.